Welcome to one and all. Myself, Dr. Tarun Prashant. Today's class is going to be on thoracic outlet syndrome. So let's go into what thoracic outlet syndrome is and what are the objectives for today's class. First, defining what thoracic outlet syndrome is. Second, knowing anatomy of the thoracic outlet syndrome, or rather what comprises of the thoracic outlet. Next, to the pathophysiology on how this occurs. The clinical presentation, which is the most difficult among all in order to diagnose these patients. What are the subjective tests clinically that needs to be done? What are the investigations on how you need to evaluate this condition? And what is the treatment method that is proposed? So let's go into what the definition is. So thoracic outlet syndrome is a group of disorders, or rather signs and symptoms that occur due to the compression of the neurovascular structures that exit out of the thoracic outlet. So what makes the thoracic outlets? It's also called as the cervicothoracobrachial region. Sounds a bit complex, but not that complex. So in order to define it, we need to know three different regions at the neck region along with the thorax. You need to understand that the interscalene triangle is nothing but located behind our clavicle, which we call as the collarbone. So in other words, in simple facts, thoracic outlet is nothing but the space between the clavicle and the first rib. But it's divided into three spaces based from proximal to distal. So the proximal most space is called as the interscalene triangle. The middle space called as the costoclavicular space, and the third space, which is a bit more inferior and lateral, which is your retropectoral space. You're going to get more of the same just in order to understand the anatomy. But prior to that, just telling the borders of these triangles. So the interscalene triangle anteriorly is formed by the anterior scalene muscle and posteriorly by the middle and posterior scalene muscles. Inferiorly, it's by the first rib. So what are the contents of this space? The contents is brachial plexus along with a vessel, which is your subclavian artery. So the subclavian vein does not pass through this interscalene triangle. This is something which is which adds on in your middle space, which is called as your costoclavicular space. The costoclavicular space, as the word suggests, is between the clavicle and the first rib. So this contains both your brachial plexus as well as the artery and the vein. So what is different in this? It is just behind your subclavian muscle. So the other important border that you need to know is your subclavius over here, whereas the retropectoralis minor space is just behind the pectoralis minor muscle and between your second, third and fourth ribs. So what is here is more of the axillary artery and the vein along with the brachial plexus. So why this is of importance is because you need to know that there are two important structures. You have your brachial plexus, which is of a more neurologic component, and your vasculature, which has both vein as well as artery. So there can be either a vessel which is being impeded being a artery, or a vein which is being impeded, which causes a different set of signs and symptoms. So if you're going to take thoracic outlet syndrome in toto, it can be divided into neurogenic and a vascular, as in either a nerve is being compressed or a vessel is being compressed. So based on which space is being crushed, the same will follow. So if you see in the first space, which is your scalene triangle, which you had already been speaking about, this is your anterior scalene muscle and this is your middle. So you can see that the subclavian artery exits through this and you have a whole brachial plexus here. Whereas just beneath this, behind your clavicle, you will find your subclavius muscle over here, and you have two vessels, one your subclavian vein and the other being your subclavian artery along with your brachial plexus. and more inferiorly you will have your pectoralis minor space just behind the coracoid. You can see that here, which is the first space being your scalene triangle. You can see anteriorly the anterior scalene muscle and posteriorly the middle scalene muscle containing two elements, one being your subclavian artery which exits through it and your brachial plexus contents which come out through the same. Whereas in your costoclavicular space, you have your subclavius muscle which is superior to this, which contains both your subclavian vein as well as your subclavian artery. You can also see that this is a space which is very narrow, loaded both by the clavicle on top and by the first rib below this. Whereas when you're coming to the third space, which is your retropectoral space, it is way more lateral and it contains your axillary vessels along with the same contents of your brachial plexus. So another image being the same, where you can see that the subclavian vein is more medial when you come in the scalene triangle. It is not a part of it. But once you come towards the costoclavicular space, you can see that it can be compressed either by the subclavius muscle or in between the space of the clavicle and the first rib. Whereas the pectoralis minor is way more lateral near the axilla just behind the coracoid region.